The impact of trauma on the health sector continues to be a challenge to health experts. It's why consultant plastic surgeon Dr. Rajiv Venugopal is reiterating his call for persons to take better care on the roads. TVJ Shamela Pullen tells us more in this week's Health Report.
The Health Report. Trauma cases account for a significant number of persons treated in hospitals. At the University Hospital alone, at least 40% of the cases seen are as a result of motor vehicle crashes. Consultant plastic surgeon Dr. Rajiv Venugopal says most times the cases involve damage on the lower parts of the legs.
When the leg is injured, it results usually in loss of skin, the bone breaking, and whenever the skin and missing and bone breaking, that's bad news because the chance of infection is higher. So having to cover those wounds is very challenging.
Dr. Venugopal says healing can take years. He says the resources that could be used to treat other conditions are being used to treat these injuries, most of which are preventable.
And trying to get the area covered may require complex movement of tissue from somewhere else and then to that location, which means reattaching blood vessels and nerves and things, which take quite a number of hours in the operating theatre. So it really takes up a burden. For example, just one patient could take up my entire operating theatre.
He reminds persons to take care on the roads. He also calls for them to wear protective gears where possible.
There are protective gears for the lower extremity, which are cumbersome and difficult to wear, but it could save them months and years of problems in the future, even if they're involved in an accident. So wearing safety gear will be crucial, and for the regular motor vehicle, just obeying what the road code says is vitally important.
With your Health Report, I'm Shamela Pullen wishing you good health. The Health Report